Basilar artery occlusion is not just a stroke, it is the worst kind of stroke. The basilar artery supplies blood to the brainstem, controlling breathing, heartbeat, consciousness, and movement. When blocked, patients become paralyzed, unable to speak, sometimes unable to breathe on their own. Without treatment, the death rate is over 80%. For years, the only hope was alteplase within 4.5 hours. To understand why this is a big deal, you need to know the basilar artery. It runs up the brainstem and feeds the back of the brain. When it clots, the consequences are catastrophic, like locked-in syndrome. The old standard required highly trained doctors for mechanical thrombectomy, which isn't available everywhere. Now, the TRACE-5 trial in The Lancet tested tenecteplase. It is a newer, clot-busting drug that is easier to administer. Just a single injection over 5 to 10 seconds. No infusion pump, no hour-long drip. The trial enrolled 452 patients, assigned to tenecteplase within 24 hours or standard care. The primary outcome was returning to pre-stroke function at 90 days. The results were clear. 38% of the tenecteplase group achieved a good outcome, compared to 29% on standard care. That is a massive 50% relative improvement. What about safety? The biggest fear is bleeding in the brain. In the tenecteplase group, 2% had symptomatic bleeding versus 3% in standard care. The difference was not significant. Death rates were also similar. Tenecteplase dramatically improves survival and function. The bottom line, there is new hope. It works up to 24 hours. If you or a loved one has symptoms like vertigo, double vision, or slurred speech, call emergency services immediately. Do not wait. Even after 4.5 hours, ask about tenecteplase. Time is brain. Time is brain. Now more time than ever.